Hello and welcome. I'm Sarah Nicolay, Research Assistant at Benjamin Rose Institute on Aging. Thank you for joining us today. This webinar will be recorded and we'll be sharing a link with all of you in an email in the next week. Please feel free to share that with any colleagues that could not join us today. You may submit a question at any time using the Q&A or chat feature at the bottom of your screen. We have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. I will now turn it over to Orion Bell, Benjamin Rose President and CEO, who will introduce today's program and our first speaker. Orion?
Great, thank you, Sarah. As Sarah said, my name is Orion Bell, and I'm the President and CEO here at the Benjamin Rose Institute on Aging. I want to thank you for joining us today for our webinar, which is entitled Senior Center Policy, Challenges and Recommendations. This is presented in partnership with the Elder Justice Coalition, and we will hear about senior center policy and serving the needs of older adults in our communities. And we'll also provide an overview of some of the challenges, strategies, and recommendations on key issues faced by older adults who utilize the senior center services. We'd like to thank Bob Blancato and the Elder Justice Coalition for their continued support, helping make today's webinar possible. At this time, I'd like to I'd have the honor to welcome our first speaker, Bob Blancato. Bob is the president of Matz Blancato and Associates, and in that capacity, he also serves as the national coordinator of the bipartisan 3,000-member Elder Justice Coalition. He also serves as executive director of the National Association of Nutrition and Aging Service Programs and is the national coordinator of Defeat Malnutrition Today Coalition. Please join me in welcoming Bob Blancato. Bob?
Thank you, Orion, very much. And it's an honor to join you and the Benjamin Rose Institute on Aging on this important webinar on senior centers. And Julie, I'll take the next slide and thank you for helping. It's a great pleasure to be with three great friends, colleagues, and leaders in Melinda, Dabney, and Abigail. I know Melinda and Dabney make a powerful impact on the older adults that they serve in San Diego and Cleveland, respectively. Sarah, thank you very much for all your help and guidance in putting this webinar together. Next slide. So the Elder Justice Coalition is in fact happy to be a co-sponsor because senior centers and elder justice do have a connection. A senior center provides socialization to help combat isolation, which contributes so much to elder abuse in our nation. A senior center can be part of raising awareness about elder abuse and how to prevent it. And a senior center director can and often does take a part in multidisciplinary teams in communities dedicated to preventing elder abuse. So let's confront the elephant in the room, which I like to do sometimes, with a question to start. Is being eligible to join a senior center a reward of getting older or a reminder of getting older? We will cover this as the day goes on. Next slide, please. So in discussing this topic, I want to throw a trivia question at the group first. For those who follow the Older Americans Act, what was the original Title V of the Older Americans Act? Well, the answer is the 1973 Older Americans Act amendments supported grants for the acquisition, alteration, or renovation of multi-purpose senior centers. That was Title V of the Older Americans Act way back. But 5 years later, without any appropriations or money being provided, it was eliminated and folded into Title IIIB of the Older Americans Act. But think about this. What was envisioned before may hold one of the keys to the future, which is multi-purpose senior centers. Next slide. So let's talk about current funding for senior centers and where most of the funding at the federal level comes from. The Older Americans Act and the Community Development Block Grant Program. And you can see the funding levels in there for Title IIIB, the fiscal year 21 final number, the current fiscal year's funding level, and what the president has proposed in his budget for Title IIIB. As you can see, a significant increase proposed in the president's budget. And with Community Development Block Grant, again, what they had in fiscal year 21, what they currently have, and what the president is proposing. But as you know, follow block grants, it's hard to figure out precise funding amounts because of the enormous discretion that states have in funding. And ACL, Administration for Community Living, doesn't keep separate tabs on senior center spending. Needless to say, advocacy is going to be needed to increase these levels. And advocacy groups are already pushing for $785 million for Title IIIB for fiscal year 23. Next slide. So we all know that the pandemic has provided many challenges, but also opportunities. The challenges faced in gaining adequate funding for senior centers may have gotten worse because of the pandemic, or may provide senior centers with a unique opportunity. The reality that everyone knows in our world due to the pandemic was that senior centers and all places where older adults would congregate were forced to summarily and immediately shut down, some as early as March of 2020. In nutrition programs, before the pandemic, 2/3 of people served in the Older Americans Act nutrition program got their meals, and they're more than a meal, at a congregate site. Next slide. But within a month of the start of the pandemic, virtually all older adults were forced to get their meals at home or get grab-and-go meals outside of the senior center. So the challenge and the opportunity for senior centers is right in front of us. How quickly, how safely, and how effectively can we see a reopening of senior centers and related congregate locations? Our NANASP Association is exploring this question as it relates to congregate nutrition programs, with a survey in the field asking these questions. Next slide. Have you been able to reopen your congregate sites? And of the 57 responses we've gotten so far, you can see that just a little over half have said fully, some say partially, and some say not open at all. What has been your biggest challenge in reopening? Staffing and volunteers, rising costs, but then the one that concerns us the most, and I'm sure we'll hear about this as the afternoon goes on, getting older adults to return. And if you look on the right-hand side of this, you see when you ask the question, what percentage of prior attendees do you think have returned? You know, that number is a little concerning. And it's where we have to concentrate our efforts to get them more to come back in higher numbers. Next slide. So the Older Americans Act of 2020 was in fact looking to the future of aging services in senior centers with the addition of a number of provisions in Title IIIB, which funds senior centers. It calls for the first time screening for negative health effects associated with social isolation and traumatic brain injury, with a separate screening for malnutrition. These screenings would likely be performed at a senior center. It continued funding for evidence-based falls prevention, chronic disease self-management programs, again, sometimes conducted at senior centers. And finally, the new law authorized programs providing cultural experiences, including the arts, to the list of supportive services, again, that could be provided in senior centers. Next slide. So the reality is the 2020 Older Americans Act amendments became law at the start of the pandemic. So the implementation of those provisions I spoke about and others have been put on hold. But as we emerge from the worst of the pandemic, we hope a priority needs to be getting older adults to return to senior centers and congregate sites. To their credit, the Biden administration in their fiscal year 23 budget recognized this reality by not only increasing overall funding for the nutrition program, but specifically increasing congregate by $247 million and Title IIIB by $101 million. But I assure you as advocates, we are not satisfied with these proposed levels, and we are working hard to get their increased, leading with a joint call from NANASP and Meals on Wheels America for a doubling of nutrition funding. Next slide. But important rationale for increasing Title IIIB funding, in fact, is the need to reopen and reinvigorate senior centers. And with the new provisions in the 2020 law, it makes it even more likely to be multi-purpose senior centers going forward. But we must also face another reality, and as I pointed out in our survey, that not all older adults are running back to senior centers and other congregate sites. And that link there will tell you more about that. We need to commit dedicated funding for public awareness and marketing targeted to reluctant returners. We can point out the benefits of being part of a senior center that are actually more relevant in the post-pandemic than ever before. Next slide. So in terms of short-term goals, advocacy obviously is right at the top. We need to concentrate our efforts on securing additional funding for the critical fiscal year 2023 for nutrition, for Title IIIB, and we need the flexibility to allow the funds to be transferred between home delivered and congregate meals as long as it's needed to get everything back to where it was before the pandemic. Modernize. There's federal infrastructure money out in every community in this country right now. It's critically important that some would be directed to building, renovating, and modernizing senior citizens. We need to have greater flexibility in how meals are served and what activities are provided in addition to the meal. Senior centers today serve people from ages 60 to 100, but that's not always reflected on what goes inside the building. We need to invest more in training for those who work today and will work tomorrow in senior centers. And there's funding available in the Older Americans Act and the Workforce Investment Act to do that. And we need to make the logical connection between senior centers and livable or age-friendly communities because they are integrally related. Next slide. So in terms of the future of senior centers, there was a report put out, well, over 10 years ago by AARP that said these fundamental questions need to be addressed regarding senior centers: their purpose, their role, their customer base, and how they achieve their long-term financial sustainability. To me, the key to the future is having senior centers remain relevant to a diverse group of people while providing outcomes that ensure increased public and private investments. It's going to be about incentivizing innovation and program integration, especially with things like healthcare reform, livable communities, and community-based work. Next slide. And two other fundamentals for the future. One, centers will work best when they facilitate older adults doing for themselves. And secondly, we should recognize that being a community focal point in the future may not carry the name senior center. People, including and especially older adults, want to be part of a full community that includes people of all ages and abilities. So since aging is common to both communities and the people who live in them, maybe we can think about a local rebranding and replacing senior centers, for example, with names like Centers for Aging Well, as is the case in some parts of our nation. Next slide. But any senior center policy agenda, whether it's for 2022 or later, must be grounded in advocacy, because there is no good policy without politics. It's about doing less siloed advocacy, meaning not just advocating for senior centers, but being more holistic, looking at the logical linkages. Like senior centers can be identifiers of broader needs and as entities providing comprehensive and coordinated services. Advocating for more funding for centers is important to senior health, but it's also for housing, transportation, combating social isolation, and more funding for community-based health, mental health services. And then finally, in my last slide, we should emerge from this webinar with a new level of excitement and empowerment to want to advocate for good and positive change. I think we're missing one more slide. Julie, if we could, there we go. We should put that advocacy energy to work short term on finding out where the infrastructure dollars are, whether it's in Cleveland or elsewhere, who's in charge of that money, and go to them with your priorities so you have a crack at getting some of that money. Ensuring adequate funding for fiscal year 23 for the various programs we talked about, and pushing finally for final action on a Build Back Better bill, which has many important investments for aging programs, such as elder justice, housing, and human services. So with that, I say thank you for the chance to be here and happy to answer any questions in the time we have allotted. And thank you very much.
Thank you, Bob. We do have a couple of questions for you. The first one is about the survey of nutrition and aging services programs. Mm-hmm. When were the results for that collected? Was it more in the middle of the pandemic surge, or was it more recent since COVID has subsided?
It was collected within the last 3 weeks. And we're still, in fact, the survey is still coming in. And I'm looking forward to each day when we get new responses that come in, but it's very current and very recent.
Great. And then the second question for you is, where would you go to find information on age-friendly communities if you wanted to get your senior center involved?
Well, there's a lot of places I think you can go to for that. ARP is very active in the age-friendly and livable communities world. The Administration for Community Living has some resources that you can learn more about age-friendly and livable communities in that space. The Department of Housing and Urban Development is working in conjunction with the Administration for Community Living on some initiatives in that space as well. There's groups called like the Village to Village Network that's working to bring their concept into the broader space of age-friendly and livable communities. And and there's other research that's out there. I'm sure that it's missing a couple of them along the way, but it's a very dynamic space right now. People are really trying to make it come together in a way that works best in their community, which is the way it should be. But as we pointed out in our presentation, you've got to be holistic in the approach that you're dealing with, because you just can't limit it to one focus. There's many pieces that comprise an age-friendly community. So I hope people will pursue that.
Great, thanks. So next we will hear from a few panelists to discuss their work with housing, nutrition, and social isolation. So I'll hand it over to Orion to introduce us. Orion?
Great, thank you. So it's now my honor to welcome our panelists today. So joining us from Serving Seniors in San Diego is Chief Operating Officer Melinda Forstey. Over the past 10 years at Serving Seniors, Melinda has spearheaded multiple affordable housing projects through San Diego County, as well as the expansion of projects such as the Serving Seniors Nutrition Program, which grew from 9 sites to 12 congregate dining sites for seniors. And they increased the number of meals served by nearly 20%, more than 100,000 additional meals in 1 year. In 2019, Melissa was elected to the National Association of Nutrition and Aging Service Programs Board of Directors, and she received her bachelor's degree in psychology from the University of Massachusetts at Amherst. Welcome, Melinda.
Great. Well,
from right here, sorry, from right here in Cleveland. I want to introduce Dabney Conwell, who is Executive Director of the Rose Centers for Aging Well and a Vice President at the Benjamin Rose Institute on Aging. Dabney has committed her career to working with underrepresented populations, developing, implementing, supervising, and evaluating social service programs. She also currently serves as an adjunct professor at the Mandel School of Applied Social Science at Case Western Reserve University. Dabney received her master's in social service administration degree from Case Western, and in 2015, she completed the YWCA's Women's Momentum Leadership Program. Dabney Conwell is an inaugural fellow with the Sisters of Charity Innovation Mission, developing the first food as medicine program in Cuyahoga County. In addition, she's a national board of governor for the Human Rights Campaign and co-chairs the local Human Rights Campaign Steering Committee. Welcome, Dabney. And finally, we hear from Abby Carney, our center director at our Gunning Park Rose Center here in Cleveland. Abby is responsible for planning, development, and supervision of the day-to-day activities at the Gunning Park Center and oversees a variety of programs and services, including the congregate and home-delivered meal programs and transportation services. She works to ensure that the Gunning Park Rose Center is an active place that allows older adults to build relationships, create a support system, and live healthier lives. And she joined the Rose Centers in 2017 as an activities coordinator. So I'm going to now turn the program over to our esteemed panelists, and Melinda is going to tell us some more. Melinda?
great. Well, thank you, Orion. And I'm just delighted to be here today and share with all of you the results of our homeless needs assessments. And also wanted to talk a little bit about the actions that Serving Seniors is doing to address these needs as it relates both to funding, advocacy, and policy. So just a little bit about Serving Seniors. Our mission is helping seniors in poverty live healthy and fulfilling lives. And we've been around since 1970. And we provide comprehensive services to low-income seniors throughout San Diego County. So if you can turn your attention to the left side of the slide, that just shares some details about it is who we serve. And so as you can see, we really are focused on seniors living in poverty, with the majority of our seniors at or below the federal poverty level. In terms of gender identity, we're split almost halfway down the middle. And we also serve a very diverse group of older adults. Currently, about 15% of the older adults that we're serving are actively experiencing homelessness, and about 80% are on the cusp of losing their housing. So it is a major crisis with the seniors that we are serving. If I turn your attention to the right side of the slide, you can see that we serve about 6,500 older adults each year. And the monthly median income is just over $1,000 a month. So if you do the math, and with the absolute lowest rents being somewhere between $700 a month to $900 a month, the individuals we serve are literally living off just a few dollars a day. We do have a team of health and social service workers that provide services at our 10 senior centers and also at the 3 permanent supportive housing sites that we own and operate. Last year, we served 1.7 million meals. So it's actually we tripled our meals during the pandemic, where we were serving about 650,000 in 2019, and again, just over 1.7 million. And to Bob's point, what we've seen is about 90% of those meals now are for home delivered. But it is critical that we really do continue to reopen our senior centers and re-engage our seniors, because so many of the folks that we work with first became engaged in our programs because of the senior center, but now have been able to access our social workers, our housing programs. We also provide activities and classes and have a really robust civic engagement program, where it's really the older adults that we're serving who are identifying the issues that they want to address and really coordinate the efforts and go to our city council meetings, go to our county meetings, and go up to Sacramento every year to lobby for additional resources. And lastly, we have a transitional housing program, and this is really the stepping stone from unhoused older adults on the streets to getting them into temporary housing before we're able to transition them into permanent housing. And this map is just a visual of our different sites throughout the county of San Diego. So why did we decide to conduct a needs assessment? Well, quite frankly, it's a crisis. Currently, 1 out of 4 individuals homeless on the streets in San Diego are 55 and older, and 88% of those became homeless while in San Diego. 43% of those older adults are homeless for the very first time. And so we were able to secure funding from the Hearst Foundations to conduct a comprehensive needs assessment. I also wanted to share with all of you some national statistics. So the older adult population that is unhoused is continuing to increase. And from the year 2017 to 2026, it's expected to grow by 30%. So just exponential growth, and really just a huge crisis that we really have to address. And, I'd like to share, this is across the country, across all states, across all communities, in urban areas and in rural areas alike. So back in 2020, we did engage a local evaluation firm to conduct a needs assessment. And really our main objectives were to gain a better understanding of the current delivery system and what resources are available. We also wanted to identify gaps and barriers that older adults and service providers were facing. We worked with a master's student to do a deep dive into policies, both at the local level, state level, and national level. And the ultimate goal was to identify best practices and recommend tangible solutions, both short-term, middle-term, and long-term solutions that we can enact right now. So throughout our study, we had 4 separate cohorts that we engaged. So we conducted a needs assessment survey for 192 older adults who were either actively experiencing homelessness or who had previously experienced homelessness. Throughout the study, though, we realized we really needed to broaden the scope and really take a deeper look at older adults who are currently housed, but right on the brink of losing their housing. So we did conduct surveys to 178 individuals. We also held 11 interviews with individuals as we were building out the study, because we really wanted to ensure we were asking the right questions to the right individuals in the right way. And then we also partnered with our regional task force on homelessness and engaged 40 service provider organizations to gain a deeper understanding to their experience working with older adults experiencing homelessness. So our major finding is that older adults are truly a separate cohort with their own needs. Our first major finding is that the overwhelming majority of older adults became homeless due to an economic or catastrophic event. So this could be due to the loss of a job or a spouse. And often it was simply increased rent on a fixed income. Our second major finding, and one of our big aha moments, was that more than half of the older adults we surveyed shared they needed only $300 or less a month to remain housed. So literally an investment of just a few $1,000s a year could have prevented hundreds, if not thousands, of older adults from losing their housing. Our third major finding was a lot of the older adults shared that they avoided shelters. They expressed safety concerns. They'd experienced verbal assault, physical assault, theft. And they also shared there was a lot of opportunity to make these shelters more age-friendly, to address their mobility needs, storage for medical equipment, and also to have more specialized staff within the shelter system. Our fourth major finding was that more than half of the service providers we surveyed shared they had not had any additional gerontological training. They expressed additional training, particularly around cognitive health, would be really helpful, along with working with individuals who may be hearing or vision impaired. And they also shared they just did not have a good understanding of all of the resources available for older adults. Our fifth major finding was a lot of assessment tools are not optimized to prioritize older adults. One example of this is a tool called the VI-SPDAT, the Vulnerability Index. And this is used by HUD across the country. And again, this really does not give priority to the needs of older adults, and particularly the economic needs that they're facing. And our sixth major finding was both service providers and older adults shared challenges in identifying and accessing services. So this could be due to mobility or transportation challenges. But we all know that the digital divide is a real issue and something that we really, really have to address comprehensively. So what did our team do? So after we released the results of this assessment, we really wanted to provide a report that was clear and direct and easy to understand. And so once we released that report, we went to the press, we went to the media, we met with funders, and then we got to work boots on the ground, meeting with our elected officials. So all of our city council members, county board of supervisors, our state assembly members, state senators, and our members of Congress. And so that was about a 4-month effort where we, again, had face-to-face, well, I should say Zoom visits, not face-to-face visits, again, with all the elected officials serving our older adults. So lastly, just wanted to share what our key recommendations and the progress that we've made from this needs assessment. So number one, we need to prioritize older adults in planning. Before we conducted the needs assessment, our team did a word search through the city's plan on homelessness, and not one mention of older adults. And the only time senior was mentioned was when it was referring to city staff members. So that was a real problem that we needed to address. And one of the major accomplishments that we do have is that we've really partnered with our regional task force on homelessness. And that is the continuum of care body, which is designated by HUD and oversees all of the programs and fundings to eliminate homelessness. Our president and CEO, Paul Downey, did join the board of the Continuum of Care, and they've formed an ad hoc committee on older adult homelessness. From that committee, they have, for the first time, prioritized older adults in their comprehensive community plan with specific recommendations. Our next key recommendation was to pilot a shallow rental subsidy program for older adults. And again, this ties back to that $300 a month that would have kept so many older adults from losing their housing. We are really excited to share that we've been working closely with our board of supervisors at the county level. And they, in fact, are creating a for older adults for a shallow subsidy program. And some of the key recommendations we were looking at is what programs have worked in other counties. So we really have been working closely with the County of LA to identify best practices. Our next recommendation is really looking at dedicating space and shelters for older adults and making them more age-friendly. And again, we are thrilled that this is now part of the regional plan on homelessness. So we have a committee that is looking at all of those key recommendations. They're also recommending a standalone senior shelter for the city of San Diego. And if you look across the country, there are very limited shelters that prioritize older adults. So this really will be an innovative model. Our fourth recommendation is to provide gerontological training to all service providers working with older adults. And we have partnered with the county and created a curriculum that we are actually going to be rolling out in a couple of weeks. Our fifth recommendation is to revise those assessment tools. And we have been working with the regional task force where we are assigning a lower weight to the tool used by HUD and incorporating other assessments as older adults are moving through the homeless continuum of care system. And then our last three recommendations is, again, to continue to remove technological barriers. You know, we know if someone is trying to access a resource, if you don't have a smartphone or even a phone, if you don't have Wi-Fi, it's a huge challenge. And even if you do have all of those resources, a lot of these assessments and applications are so hard to navigate. So what can we do to break down those barriers? Our seventh recommendation is to really look at addressing the transportation and mobility barriers. So bring services to where the individuals are. And again, to Bob's point, look at continuing to invest in senior centers where older adults are coming in. And also look at making this mobile, particularly with the homeless population. And our last recommendation, of course, is that we need to continue to invest in affordable housing. Right now, about 70% of older adults who are on waiting lists have a 10 to 12 year wait before they're able to move into affordable housing. And so we need to pool all of our resources together, both at the state level and the local level, to make a concerted effort to continue to invest and expand affordable housing. So with that, I will turn it over to Dabney. Thank you.
Thank you, Melinda. It's coming. There we go. Hello, everyone, and thank you so much for joining us this afternoon. I also am thrilled to be here to be able to talk with you today about social isolation, but really starting to shift how we think about social isolation. Go to the next slide, please. We have all had the universal experience of what is social isolation. We lived through, or we're living through, a pandemic where we could all talk about it and have our own stories. However, what we know to be true as social isolation is applied to aging, it is seen as a deficit problem. In the context of older adults, we've talked about social isolation as a descriptor of how older adults experience, they define the older adult experience. Social isolation and loneliness have been definitions for, or justification, excuse me, for senior centers. And also senior centers in some ways may have been designed to actually fix social isolation and loneliness matters. But in many ways, it reinforces the ageist narratives that have become what many of us, and I'm sure those on this call, have seen as our work. Because it talks about older adults and in the context of losing capacity to do new things as we all age. The inability to learn, that aging is a loss and not an opportunity for longevity. Next slide, please. And so as we think about how do we talk about this in a way that is seen as not a deficit, aging is not a deficit and social isolation is not a deficit, it's really thinking about a paradigm shift. That we start to talk about it in the context of social connectedness and moving away from diminished social capacity and contact and loss to really start to shift to what are meaningful, close, constructive relationships with other over the lifespan. And it allows for discussion around agency and resourcefulness throughout the lifespan. Next slide, please. So this concept of social aging, so instead of aging alone, we talk about aging as what we do together, as what we do because we're connected to others and in communities and neighborhoods. As a concept, it's defined as social aging. Next slide. So really, what does this mean in practice? It is not abandoning what we have come to know as our senior centers, but instead it is aligning in a different way and making sure that we have the ability to connect to all older adults, regardless of their intersections and including their multiple intersections as we think about how do we plan for and with this population. The emphasis is on programming and connecting, again, all older adults for the purpose of building strong critical networks for well-being. Next slide. So Benjamin Rose and the Rose Centers, what we've done is begin to look at a innovation solution that we're calling Rose on the Go. And Rose on the Go, the goal of Rose on the Go is to help active older adults, or even adults, I should say adults, connect to locations that are accessible in their neighborhoods where they reside, and places that they frequent without stigma or the restraints of scheduling. The purpose is really mobilizing community organizations to build vibrant neighborhoods. So it's moving away from saying that this is this building that sits in a neighborhood that is not necessarily connected to the neighborhood, but really saying who is in this community that has invested interest in keeping this community a vibrant one where people call home. And so the programming for the Rose on the Go as a solution is, we think about it in 4 pillars. So it's health, security and safety, dignity and independence, and connectedness. And so all of the programs and opportunities that are put forward under Rose on the Go umbrella fall within those 4 pillars. Really thinking about redefining engagement by embedding opportunities and experiences not bound by a physical structure in the community. So it helps to move away from thinking that all older adults who the moment they turn 60, that they will gravitate to the senior center building that's located in the community, but allowing us to say that it is not the walls that bound and make the walls that bound us don't make a senior center or a senior experience. And so taking those opportunities out into the community where everyone has access to them, regardless of where they're taking place. Next slide, please. So our policy recommendations around this, it gets to what Melinda has spoke to as well as Bob spoke to, which is really thinking about how do we advocate for this on purpose and not as a secondary thought, and thinking about older adults in the context of their different intersections, and that not all seniors are a monolith. And so advocating for them, advocating for those policies on behalf of older adults, and also realizing that we currently don't have policies that govern how senior centers operate. So by default, we end up running parallel to one another. And then recognizing that policy drives change. And so the only way that universal change happens and it is sustained is that we have policies that support the work of all older adults. Policy inspires funding for innovation, and that policy reinforces the structural aspects of social relationships and encourages opportunities for older adults to engage in a larger network. Next slide. My contact information, here's where I can be reached for any questions or comments, but I'll also obviously be around for additional conversations at the end of the presentation. And with that, I'll turn it over to Abby Carney, who is our Senior Center Director at Gunning Park Rose Center here in Cleveland.
Hi, everyone. Thank you for being here today. My name is Abigail Carney, and I'm the director at the Gunning Park Rose Center. Today, we're going to talk about the nutrition services and the policies that we use at the Rose Centers and the challenges that we see on the ground in the senior centers every day. So next slide, please. So just a quick overview of what we're offering currently at Gunning Park, and I'm sure you'll see in most senior centers around the country, is that congregate meal service. So that's kind of just been that standard program that most senior centers offer. Usually funded under the Older Americans Act, and that is the Title III-C nutrition program. And so in addition to those congregate meal services, we're providing any social, educational, physical programming, as Dabney was talking about, trying to provide that social connectedness experience for our older adults. And then also providing a transportation service. So this is a service for older adults to come and go daily at the senior center, but also providing a special trip experience that allows them to see different cultural experiences in their area and different shopping and out to lunch experiences with their friends. So we provide that as well. And then through COVID-19, we've seen the response for grab and go meals. So this was a response to us closing to be able to provide meals in a safe way for older adults to pull up even outdoors to our back door and serve them in that way. So that was people who didn't feel comfortable coming into the building even after reopening. So we still see part of that still happening as cases decline and things start to reopen again. Next slide, please. So a few of our challenges, because senior centers have no governing body, the daily operations of senior centers often default to the Older Americans Act standards. And this has posed some challenges for us because of the many restrictions that come with the Older Americans Act. So starting off with the low reimbursement rates. So that really has an effect on how we employ and staff our senior centers, because with these low reimbursement rates, we're only providing partial coverage for our food and not really the true cost of what a congregate meal program takes to run. So we're forced to find other funding streams to cover things like staffing and supply costs. Another thing is the strictly balanced meals. So this prohibits any sort of modification for diets. So low carb for diabetics, gluten-free options for bread, kosher meal options, vegetarian options, medically tailored meals specifically. And this really ostracizes certain groups of people not being able to make those accommodations. Another challenge is not allowing choice for our participants. So at senior centers, we're trying to promote independence, autonomy, and freedom of choice. Not having the option to choose what you want to eat kind of goes against these foundational elements that we have as senior centers, especially pushing this food as medicine, and where older adults don't have the choice to pick what goes in their bodies. Also, with the meal only covering 1/3 of their daily food intake, just providing the one meal, we're not considering people in the room who may need a larger calorie intake, or those who don't have food at home to cover those other 2 meals. One meal is not enough to fill that full daily nutrition guideline. And then no food is allowed to leave the room under the Older Americans Act. So the only thing that is allowed to leave the room is any whole fruit or milk. But this creates either waste or overeating. So if someone only ate half of their lunch, they would either need to finish it, which is often what we see. This generation specifically, doesn't want to waste any food. They'd rather overeat than throw it away. Or also just throwing away the meal is your only other option. And so it gets to our waste factor. And then because of all of these things, it's restricting the innovation that we can make in the congregate meal space. So changing the way we do things is often difficult when any and all ideas go back to one of these restrictions. Next slide, please. So some ways to inform policy change. To communicate the key challenges we're seeing in our everyday work. Providing use cases would be helpful for advocacy to provide people that don't fit that standard when it comes to those rules. Giving some examples to modernize the congregate meal program to attract new participants. So this could be some examples that we'll give later, but really just dreaming of all the things what a congregate meal program could look like. Surveying participants that are currently a part of your congregate meal program and their suggested improvement strategies, but also the people that haven't come back or have left your congregate meal program for one reason or another, surveying them to see why they left and if there was anything that we could improve to keep them or bring them back. Providing any financial documentation of our true costs of running a congregate meal program and how the current funding structure doesn't match what we're doing now. And then advocating for participant choice. People should be able to choose the food that they eat, and especially on a day-to-day basis, most of the people we see are multiple times a week. So it's multiple times a week that they don't have a choice in anything on their plate. Next slide, please. And then lastly, some recommendations for policy change. So of course, increasing those reimbursement rates to reflect our true cost. That's like an all-inclusive price of staffing, supply costs, and food. Evaluating our reimbursement rates more frequently. So thinking about, right now we're all hearing about the rising food costs and experiencing them in our daily lives. But our rate for reimbursement will stay the same for 2 contract years. Increasing food options, so this can accommodate diets and personal choice. Adding options for additional servings or take-home meals for someone who needs something for dinner or a higher calorie intake. And then modernizing the meal space to fit the current needs of people. People want more options. So this could include something like a salad bar, indoor and outdoor dining, modern spaces that feel young, fresh, new, served beverage service, and served meals. So this would feel more like a restaurant rather than a cafeteria style. And then making grab and go meals permanent. Not only was it a response to COVID-19, but what we've really been seeing in the senior centers is that the grab and go schedule, being able to pick up in an hour's time rather than a set meal time, has been accommodating for caregivers and their care partners, or someone who has multiple medical appointments and can't make that 11:30 hard lunchtime. So that grab and go is providing more benefits than we originally anticipated. And that's it for me. So thank you guys so much. And I appreciate your time today.
Thank you everyone for sharing your work with us. We have time for a few questions. So this first one, I think anyone could answer. So just jump in if you want to. What advocacy methods have the presenters found to be most successful for seniors?
So I'm happy to jump in. I think it's always critical to really have a story when you're meeting with anyone, so you have a human face to it. So I think that's the number one most critical thing. But in addition to that, it's always helpful to have data to back up whatever it is that you're advocating for, and to also, if you can, perhaps point to a best practice. And I will just give one quick example of what Serving Seniors did. So about 10 years ago, the city had cut our funding for senior nutrition. So we had 60 of our older adults march down to City Hall, and they all held empty plates. And so that visual of showing these folks you're cutting food literally from their mouths, I think was really powerful.
It's a good example. The next question, anyone could answer also. So there are so many older adults who are isolated and not reaching out. What types of outreach has been done to help solo agers know that there are programs out there to help them age in place comfortably?
So for us in our communities, really reaching out to other organizations where people naturally reside is something that we're really working for. So that's your local library, even the local McDonald's. So those kinds of places where people just naturally go, especially for their morning cup of coffee. And then also looking at mailers for specific communities and zip codes is something that we're working for, to bring people back, and especially those folks that are alone and haven't heard of your service before. So that's what we're looking at here with the Rose Centers.
I would also just add to Abby's point, the other space that comes to mind is connecting with medical entities where folks are going to doctor's appointments, and making sure that those services are known within medical care providers. So creating those partnerships that might not be natural partnerships for senior centers, but it's shown its face to be a good space where someone naturally travels.
And I would just add, we've been partnering with a lot of older adult housing facilities throughout the city, and really developing those partnerships with the property managers there so that they know about our services in our senior centers.
Thank you. Our next question is, how do you fund and staff your meal programs with the drastic increases that you've seen during the pandemic?
So I'm happy to jump in again. We do fundraise a lot. So we reach out to individuals, we reach out to foundations, but most of the funding comes through the federal government. So we have now made a concerted effort to go to our county and our state to ask them to kick in funding as well.
I'd say the same for us. Mostly, our annual fundraisers and things that fun. Dabney, if anything else, feel free to
No.
jump in. Yeah.
Yeah, I think that would be the answer.
Great. This question, I think, Melinda, is for you specifically. On key finding number 4 about service providers lacking gerontological training. When you said service providers, did you mean senior center staff or staff at the shelters, or both?
It was primarily focused on folks working in the field of homelessness and housing. But this is something that we are looking to take on the road, and we will be reaching out to other senior centers throughout the county.
Great. And we have one more question. I think, Dabney, this one's for you. Have you seen any consequences of social isolation from the pandemic, making everything either virtual or canceled? Or do you think that older adults have adapted their social lives and that's why there are less people returning?
Yeah, great question. I start off, my first gut answer is older adults are not a monolith. And so I think there's a little bit of all of that happening. For older adults who are comfortable connecting, they connected. For those who are not, they didn't. And so some of the reservations around returning, it's a couple of different answers. Some of the folks who are reserved about not returning are health concerns. Others have filled in the blanks. So things that, coming to the senior center was so much a part of their world for many years. And then when the pandemic hit us, some were needed in other spaces. So we find they're now not available because they've become permanent childcare. They're not available because there are other pulls on their time. They've become caregivers for different reasons, and different family relationships. I will also say, to Abby's point, we have found that I still want to come to the senior center, but I don't have 6 hours of my day to give away anymore. And so I will come for a specific activity, and I will stay for that activity and take my lunch to go. Or I will just come and pick up my lunch and not stay. So I think there's a lot of answers to that question. And the answers are as unique as the individuals that come to us.
Thank you. So thank you, everyone, for joining us. And thank you to our presenters for sharing such great information. In the chat, you will find a link for a webinar evaluation that we hope you'll complete. Your feedback is important to us as it helps us improve our programming. The link will also be shared in email with you soon, including information on where you can find a recording of this webinar and copies of the PowerPoint presentation. We hope you will plan to join us for future webinars that we plan to hold throughout the year. More information can be found about all Benjamin Rose research services, programs, and events at www.benrose.org. Thank you, and we hope you have a great rest of your day.